Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening to you. Welcome to another edition of your Health and Wellness Show. And we talk a little bit Ramadan as well as fasting and diabetes. Those suffering from diabetes, if you are a diabetic, this is the show to watch. So grab your chair, sit back and relax. We have specialist physician in studio with us. Don't forget to interact with us if you have any questions, comments or queries. I will forward it through to our doctor, inshallah, and have your questions answered. And follow us on our various social pages. And if you've got any colleagues, family and friends watching, or that you have them around the world across the beautiful seas, they can watch us via our live stream, that is hilaal.tv, and catch the show the next day on our uploads. In studio I have Dr. Kumari Naidu, who is a specialist physician, endocrinologist and diabetologist. She graduated as the top medical student at the University of KwaZulu-Natal in 2010 and completed her internal medicine examination in 2017. Now, in 2019, she was awarded the prestigious SEMD Society of Endocrinology, Metabolism and Diabetes. She treats diverse spectrum of endocrine pathology, but has a special interest in the holistic management of young people living with diabetes, obesity, and gender issues. She maintains a keen interest in academics, having her master's in osteoporosis and researching the patterns of metabolic syndrome in local population. She's also a regular speaker at CME events and serves on the National Type 2 Diabetes and Hyperthyroidism guideline committees. I hope we can use this time to share some valuable information that will empower people living with diabetes, those at risk, and even family and caregivers, as well as these people around suffering from diabetes. So let's now welcome in studio Dr. Naidu. Thank you so much for your time. We really appreciate it because literally you landed today and you came straight to the studio.
Good evening, Gawa. Thank you so much for having me on the show. It's such a pleasure to be here, and salams to the viewers as well.
So you're based in KZN,
yes.
And that's where you practice as well.
Yes.
Let us quickly understand what we're going to be talking about, because we've chatted about quite a bit of things. There was so many. I mean, and you're a specialist physician, and often they don't know the endocrinologist sometimes specializes in diabetology as well.
Yes.
So what can we look forward to? Because you've got some great news, you've got some guidelines when it comes to food, exercise, and also questions that myths and misconceptions
about diabetes.
Yeah.
Yes. So I think today, although I am an endocrinologist, we're going to focus on one part of my job, which is the diabetes, and which is a passion of mine. I think we're going to be talking a lot today about the youth and why diabetes is such a concern in young people as well. I wanted to share some important information about if you've just been diagnosed with diabetes, what is the next step? How should you be managing yourself? Because we know that this is not just a disease that we treat with medication. Lifestyle is so important. The next thing we thought we would discuss is a little bit about Ramadan, as the holy month is coming up soon. And I actually brought along a really lovely special Ramadan cookbook, which was written by a friend and colleague of mine, and I thought we could chat about this as well.
She just happened to do a show with us for Faiza, which we actually, I'm trying to get her to do some stuff for us for Ramadan, inshallah, so that we will definitely look forward to. But this leading idea, and the last show that we've done on diabetes was diabetes post-COVID.
Yes.
And how the increase of diabetes had, at least the pandemic, resulted in somewhat of the increase of diabetes patients being diagnosed. So what are is diabetes being labeled the epidemic of the century?
That is just because the rate of new cases of diabetes is increasing dramatically, Kawa, and that is across the globe. In every single country, in all parts of the world, it is predicted that the numbers of new people with diabetes is going to rise. But what's quite scary is that the highest impact of the diabetes epidemic is going to be on the African continent. We actually know that in South Africa, we have some of the highest rates of diabetes for the entire continent. And this is probably driven by the fact that in addition to diabetes, we also have very high numbers of obesity in our population. So it comes down to lifestyle. It comes down to our modern lifestyle. You spoke about COVID, and during COVID, the pandemic and lockdown, our lifestyles changed dramatically. It became very normal for us to be confined to our homes, not to go out and exercise. People stopped be couch potatoes. People stopped going to the gym. You would work from home. You would be on Netflix for hours of the day.
Binging.
And that's almost become normal, but it really has had a negative impact on metabolic health.
We're looking at some of the stats here. Doctors, take us through some of that.
So this is basically just showing us a map of all the different areas of the globe. And you can see, as I said, for every single country, you just see up arrows. Everywhere there's a projected increase.
And Africa being 143% increase.
So that's saying that in Africa, by 2045, we are going to see 143% increase in the rate of diabetes.
Yeah.
And if you look across the globe, Africa has the highest predicted increase.
Yeah.
And we need to ask ourselves why is this? Why is the developing world bearing the brunt of diabetes? And, part of it is lifestyle, and it is also because, a healthy lifestyle is becoming more expensive to live.
Yes.
And, healthy foods are expensive. Joining a gym is expensive. And so in our parts of the world where we are resource limited, it is becoming difficult to really strive for a healthy life. And I think this is just one of the reasons why we are really being hard hit by the diabetes
Is that
epidemic.
taken into consideration when you are diagnosed, or depending on what type of... Let's look at the diagnosis and how that affects what you just mentioned now, affects the diagnosis, and then also just run through some of the different types of diabetes.
Yeah. So the one thing that I would like to say is that, and very important when it comes to numbers as well, is that, of all the people in South Africa who have diabetes, 50% of them actually don't know they have diabetes.
Wow.
So they are walking around undiagnosed.
Yeah.
The reason that this happens, however, is because diabetes doesn't always present with symptoms. The symptoms, which are the thirst, the excessive urination, the fatigue, the weight loss, that only comes after years of hypoglycemia and very high glucose levels. So it's very possible for people to be operating as normal, but to be operating at very high sugar levels. And this is the risk of undiagnosed diabetes.
And hypoglycemia is having very high sugar.
Very high sugar. Hypoglycemia is having high sugar. And what we worry about is, even if you may not have symptoms, but you have high sugar levels, those high levels of sugar in the blood do damage to the organs. They damage the vasculature and they result in complications. So, this highlights the importance of looking at people who are at high risk of diabetes, advising those people to screen so that their diabetes can be picked up early and can be managed early. And what are some of the tests that we do? You asked me about diagnosis. Well, if you're someone who's got all the typical symptoms, the weight loss, the thirst, the excessive urination, then it's really as simple as doing a random sugar test. And if we get a level that's greater than 11.1, that classifies as diabetes. But, in people who are maybe not symptomatic, we may do a test called a hemoglobin A1C, which gives us an idea of what is this patient's 3-month average blood glucose. If we get a value of greater than 6.5%, that translates into a diagnosis of diabetes. And then the other way to go about testing for diabetes is to do the full oral glucose tolerance test. And this is the test that I'm sure our listeners will know is we ask you to fast overnight, do a fasting sugar in the morning, have a glucose drink, and then do a 2 hour later, we do the sugar level. And then based on what the fasting level is and what the 2 hour level is, we are able to tell you from that, are you normal? Do you have diabetes? Or actually, are you in a pre-diabetic phase? And that is something that's very important to detect, because then an individual knows they are at high risk and they can start implementing all the necessary lifestyle changes to prevent them from progressing to diabetes eventually.
You've mentioned some of the symptoms, and those are the common symptoms. Are there any other symptoms that one can recognize?
Well, blurred vision is something a lot of patients complain of. That's because when sugar levels are very high, they actually tend to swell the lenses of the eyes, and you may get blurred vision. A lot of my patients with newly diagnosed diabetes complain of nerve pain, so they may may complain of numbness, tingling, burning in the feet, a hot sensation, and that is something that can come on when the sugar levels are very high. And then another way that we diagnose diabetes often is with infections. So, if you're diabetic, you have a compromised immune system. You may have a higher risk of infections, and these are particularly skin infections and urinary tract infections, foot infections. So if we see someone coming in with these issues, it's an important, important marker to screen, to check the sugar and see what it is. Okay. And then another way is patients presenting with complications and not knowing they have diabetes. So every person who comes in with a heart attack or a stroke, we will always screen for diabetes, because that is the underlying risk factor.
Okay, we chat more on diabetics and how you can prevent it, possibly also understand, go for your necessary screening. We also will be indulging you with some information on Ramadan, some helpful tips around that. So please do stay with us as we continue our conversation around diabetes, fasting, and some new technology we'll look at as well. Back in a moment. Stay with us. Assalamu alaikum. Welcome back. This is Health and Wellness. I'm Hawa Solomon. Stay with me as we just about started with diabetes, fasting, and some new in the industry. If you want to know, please stay connected to us and tell your friends they can also stream live right now via hilaal.tv. So in studio we have Dr. Naidu with us, a specialist physician, talking on diabetes and how we can manage it, what to identify. We want to look at some of the screening issues, the fasting, what to eat, and who should not be fasting during Ramadan. Okay, so let's look at some of the long-term consequences of having high blood sugar.
So what diabetes does over time, over years of having high blood sugar levels, is it damages blood vessels. It damages both small and large blood vessels. So the small blood vessels we call microvascular complications of diabetes. These small blood vessels supply the eye, the retina of the eye. They supply the kidneys, and they supply the nerves as well. So patients can then end up with blindness, they can end up with chronic kidney disease, leading on to renal failure and needing dialysis.
Amputation, I see there as well.
That's a large vessel complication. So the other small vessel complication is neuropathy. On the other hand, our larger vessels are what supply our heart, our brain, and our limbs. And that is what can lead to the amputations, the heart attacks, and the strokes.
And that's where the death occurs?
Yes, that is where we have the risk of mortality.
All right, let's look at those that need to be screened, because you spoke about, high risk, and you could be walking around having diabetes for years and years and not even know.
Yes, so we say if anyone over the age of 45 should be screened at least once every 3 years. But if you have a risk factor, then you should actually seek screening immediately. And what are these risk factors? So the first thing is a family history. If there's a strong family history, particularly if people are getting diabetes and being diagnosed at an early age, you should test. If you have some of the associated risk factors, so diabetes often groups with other conditions that affect cardiovascular health, and these are hypertension and high cholesterol. If you have those conditions, you need to test for diabetes as well. Being overweight or obese is an important risk factor, and this is especially if patients carry their obesity in the abdominal area, because we know that obesity in that distribution is a marker of having fat around the organs. That can lead to insulin resistance, and that is the risk factor for diabetes. And the other important group to test is women who have developed diabetes during their pregnancy. So if they've had gestational diabetes, that may resolve after pregnancy, but there's always a chance of it coming back later on.
Is the screening only done via your doctor, or can you go straight to the lab?
I think the best thing is to do it in conjunction with your doctor, because if you go straight to the lab, you'll end up with a result that you don't really know how to interpret. So I think do it via your doctor. You'll get a holistic approach. And then, of course, we're not just testing diabetes. We're looking at weight, we're looking at cholesterol, we're looking at blood pressure, so a full health assessment.
So once you are diagnosed with possibly being diabetic or pre-diabetic, what is the next step?
So the next step is to embark on a management plan with your doctor, Hilaal. And I must also stress that it's not just the doctor; it's also a multidisciplinary team that manages diabetes. So it's your doctor, it's maybe a dietitian, and in diabetes, the nurse plays an extremely important role, and we actually have specialized nurse educators who are trained to interact with our patients. And then depending on what complications may have already arisen, we may then be referring our patients out to maybe foot specialists, podiatrists, to ophthalmologists to screen the eyes, etc. So it really is a multidisciplinary team approach. But basically, when we start off, I have a little mnemonic that I like to use to guide me through how I manage diabetes, and it's meals. So the M stands for medication, because that is an important part of management. And here I would stress to the listeners that when starting medication, I often am faced with the challenge where my patient starts it, they have a side effect, they stop the medication, and when I see them 6 months later, they're coming to me off treatment. And in that case, we lose a good amount of time where we could be treating. So I would say that if you have any concerns about your medication, or if you have side effects, and that's something that we expect as well, rather than stopping, let your doctor know so we can adjust treatment for you. The next thing in my mnemonic is eat healthy, and that's I'm sure we will go into healthy eating in detail, but that's extremely important. The next E is exercise, and exercise is described almost like a superpower for managing diabetes. That's how important it is. The L is lose some weight if you need to. We know that overweight and obesity is probably one of the most important risk factors for diabetes. But if we control that weight, and even if we're getting 5 to 10% of body weight loss, we are seeing significant improvements in diabetes control, even to the extent where we are withdrawing certain medications or reducing insulin doses. And then the last two steps are sleep. Maybe we'll talk about the importance of a good sleep, and stop smoking if you are.
So meals, remember that.
Meals.
Take you through that. And who would be managing your diabetes? How often do you necessarily have to do the follow-ups? And when do you need to see your doctor?
When do you need to see the doctor? So who should manage diabetes? That's an interesting question, because there's a lot of interest in managing diabetes today, and it can be managed at various levels, by a general practitioner, by a specialist physician, by an endocrinologist who's sort of a super specialist in the area. And we also have our GPs who have done special additional training in diabetes, and they are regarded as diabetologists. So really, you can be managed at any level for your diabetes, but what I would suggest is you need to find a healthcare practitioner who is very up to date in the subject and who's also passionate about managing this disease. The reason that I say that is there has been a dramatic increase in our knowledge of diabetes, our understanding, and also what we can give our patients access to. So you really need someone who's up to date in terms of managing. And then the next step is you need someone who's got enough time to sit with you as a patient and develop an individualized management plan. For every patient, diabetes is different. They've got different concerns, they've got different priorities, and we need to select our medication for the individual.
Let's talk about the numbers. I don't always quite understand the numbers when I hear this one saying, oh, my sugar's high today, it's number whatever. What is important that we need to know the numbers, and when should blood sugar levels be tested?
Okay, so there are a few important numbers or magic numbers to sort of know. And I like to actually encourage my patients to start thinking about those things. It's not something that only the doctor should...
We've got the numbers up.
We've got the numbers out there. So it's not something that only your doctor should be aware of. Patients, if you engage with these things, you are empowering yourself to manage your diabetes better, and you know whether you're reaching your goals.
Okay.
So the first number we've got on the screen there is something called HbA1c or hemoglobin A1c. gives us an idea of what one's average sugar is for the past 3 months, 3 to 6 months. So it should usually be repeated every 6 months, and we use it to see how our patients are doing. So for most patients, we should be targeting a hemoglobin A1C of around about 7%. That equates to good diabetes control, but that value is also very individual. So if we've got an older patient, if we've got someone who's got lots of complications, we will allow a higher value because that is safer for them. The other thing, however, that we need to be aware of is diabetes is not just managing sugar. It's also managing all the other risk factors that can impact heart health. So the other important numbers that I had up on the screen there were firstly blood pressure. That should be around about the top reading systolic between 130 to 140 millimeters of mercury, and we want diastolic blood pressures between 80 to 90. Cholesterol, extremely important when managing someone with diabetes. And I say to my diabetic patients, you know, I'm going to treat your cholesterol extremely well, because if I know I'm doing that, I'm taking away an additional risk factor for heart events and other complications. So we look at a specific cholesterol value called LDL cholesterol, and in someone with diabetes, we usually want that to be around about 1.8 or even lower. And then weight. Okay, we want a body mass index of around about 20 to 25. And we also want to encourage our patients to try to lose that abdominal weight, which aggravates the diabetes.
Now let's talk about weight. Let's understand the dietary tips that people living with diabetes needs to know about. How do you also start an exercise routine if there isn't, if you haven't even exercised before? But let me just look at the time. Okay, we've got a minute or two left.
So maybe what we'll say is we'll talk a few tips on exercise. So what I will say about exercise is any amount of exercise is beneficial. I was reading a study which said that if you just walk for 6 to 8 minutes a day, you can increase your lifespan by 4 years.
Wow.
So there's no excuse. And I encourage my patients to start slowly. So ideally, we want you to be doing about 20 to 30 minutes of walking, at least 5 days a week. But wherever you are, start and build it up until that stage. The other thing which I find quite useful for patients who are maybe in wheelchairs or who've got limited mobility is, for them it's important to keep the circulation going. And there's an exercise called calf raises, which my podiatrist at the practice taught me. And it's a simple exercise which you can do if you're sitting in your chair, and you just would place both your feet on the ground and you would press up onto the balls of your feet. And that is actually activating your calf muscles and improving your circulation.
Well, so no need to even get up.
You can start with 50 and you can go up to 300. And then the other aspect of exercise which is critical is also introducing some exercises which build muscle and which maintain muscle mass. So some sort of resistance exercise, whether that is using your own body weight, using very light weights, using resistance bands, or doing something like yoga or Pilates. We want that muscle mass as well.
I love Pilates. It's such a moderate exercise and often doesn't use great strength or endurance.
But it builds your strength up so wonderfully, and that's what we want in our
Can't wait to
patients
see
living with diabetes.
the recipe book, and we'll chat about more hints and tips. And if this condition can possibly be reversed, they say it's a lifestyle condition. We have a specialist physician in studio with us, endocrinologist and diabetologist. Don't forget to interact with us. We'll be back just after this. Welcome back, Assalamu alaikum, and we have a specialist physician in her field managing diabetes on a daily basis based out in KZN, Dr. Kumari Naidu, and she literally stepped off the plane and came straight to the studios to do this recording. Thank you so much. We've been trying to get hold of you since last year, thinking that we need to talk about obesity, need to talk about lifestyle, but in fact there's a big love that you have for diabetes and young patients, which you also want to talk about. And this comes in with a question of lifestyle and being a lifestyle condition, and can it possibly be reversed, and how does it affect so many young people? Why, rather?
So whether it can be reversed, that's a really hot topic, and it's something that patients are hearing about and something that they ask me when they have just been diagnosed. And however, the answer is actually yes, it can be reversed. Not in everyone, but particularly if you've just been diagnosed with your diabetes, and if your diabetes is related to excessive weight, then there is a high possibility that you can actually reverse it with lifestyle management.
Is it just weight management? Because I've also heard in people that have suffered a trauma, a loss, a death, their insulin levels also increases, and they could possibly be pre-diabetic because of their emotions. Is that possible?
Well, I think what it is that, any sort of trauma or stress does have, it does result in a hormonal response in the body. So it triggers that flight or fight response where you are, where you're a little bit on edge. And those hormones actually do have an effect of increasing the blood sugar. So that is probably the link of how stress can actually precipitate something. But usually the tendency is underlying. So usually, there is a genetic tendency, and then whatever is going on in life can bring out these things at times of difficulty. Maybe what I should just explain is why we keep speaking about the link between weight and diabetes, and why that is the key to actually reversing diabetes. And the thing is that, when you are overweight, it basically means that there has been an excess of calories that has been taken in over time. Now, when there's an excess of calories, the body needs to store those, and it stores obviously in the fat depots, but it also stores.
We have a perfect diabetic plate. Sorry.
It also tends to store in and around the organs. So you will store fat in your liver, you will store around your pancreas, and that will make you insulin resistant. So although your pancreas is producing insulin, the insulin doesn't function as well as it should, and that is probably one of the first steps to developing type 2 diabetes. So that's why we say if we can actually drop the weight, those stores around the pancreas and around the liver are broken down. Insulin sensitivity improves, and that's how we reverse the cycle of diabetes. So if you have, for instance, gained a lot of weight, and if we go on to measures to reduce that weight, whether that is diet and lifestyle, whether it's medication or even bariatric surgery, we actually can sometimes find that the sugar comes down, and we may even be able to withdraw therapy for diabetes in these people.
And now the big question of people living with diabetes: can they fast during the month of Ramadan?
That's an important question. I'll start by saying that as medical practitioners, we acknowledge that every Muslim wants to fast. It's a time of huge spiritual reward, and we know that as doctors, if we tell a patient it's not advisable, for them
they're not always going to listen.
And they're not always going to listen, but it's also, it's something that's disappointing for the patient. The reason that we are just a bit concerned is that because of all the lifestyle changes that happen during Ramadan, the changes in eating, the changes in sleep, activity, hydration, it can actually precipitate certain complications of diabetes. Those are the high sugars, hypoglycemia. We can have low sugars, we can have fatigue, dehydration, and some more serious complications as well. So the key to who can fast if you're diabetic is actually individual, because what needs to happen is an individualized risk assessment to assess what is this patient's risk that comes with fasting. If they are at low risk, then we are happy for these patients to go ahead with fasting. Even patients who are at moderate risk, with some modification to their treatment regimen and with better monitoring, many of these patients can also fast safely. It's just identifying those patients who are at high risk of complications, and it's in these patients who we will then say,
scores up, doctor, of the low risk.
Some scores. Yes. So we have actually a scoring system. This is something that's been developed by the Diabetes Alliance in Ramadan, as well as religious authorities as well, to try to marry, our medical advice with religious recommendations as well. So there's an entire scoring process that we would go through when a patient comes in. What that scoring system basically encompasses is factors related to your diabetes. For example, what type of diabetes do you have? How long have you had it for? What treatment are you on? What complications do you have related to it? We will also look at the patient themselves. Are they able to manage their diabetes? Are they able to monitor? And then we will also look at the characteristics of the fast. So how long will these patients be fasting for? And then putting that all together, we'll come up with a score. So there you can see the score. If you have a less than 3, low risk, and we will happily allow you to fast. 3 to 6 is a moderate risk where there may be some risk associated, and we then need to we need to educate our patients, and we maybe need to adjust treatment. And then if that risk is above 6, that's where we are saying that fasting is not advisable in these patients. And I think, we do need to remind our patients that when we are recommending that fasting is not advisable, we also don't want these patients to do harm to themselves. And I believe that is one of the teachings in Ramadan as well, is that the fast itself must not
shouldn't harm the individual.
Must not cause harm.
Let's talk about the risks and the harm that it does cause your body if you are diabetic and you're fasting.
Yes. So the first big group of complications is that related to uncontrolled blood sugar. Obviously, if you're not eating for a long period of time, but you still have to be on medication to control the blood sugar, then there's a risk of low blood sugar, and that is hypoglycemia. And I think maybe an important time to tell the viewers what are the symptoms to look out for in hypoglycemia. So that is hunger, that is feeling sweaty, feeling palpitations, maybe a little bit of dizziness and headache. But I'm sure you would tell me, as someone who's fasted, maybe you may feel those even though you don't have diabetes. And that's why monitoring is so important during diabetes, because it's hard to differentiate what are the symptoms that are just coming from fasting versus what are symptoms actually due to complications. And that's why we need our patients to self-monitor.
Okay. And you need to take us through that, how to self-monitor, how to look at, and when do you actually check your sugar?
Yes. I must just mention that the other group of complications, not lows, is hyperglycemia. And why would that be the case? Because often we are reducing medication doses during Ramadan fasting, but also the diet changes dramatically during Ramadan, doesn't it? How there's suddenly a lot of high carbohydrate food, a lot of sugary desserts, high fatty food. So,
oil,
and at that time, at iftar, I think people are excited, they want to eat more, you're eating a lot of things, so you want to spoil yourself and reward yourself. So we can find in patients with diabetes that at around the time of iftar, we may see a large spike in the blood sugar, and that can be dangerous.
I must say that there has been talk, just in my conversations in the community and the young people that I've chatted to, and even the old people, they're trying to lead a life that of the Prophet, peace be upon him, of how he ate and what he ate, and using those sunnah practices of eating. And if you look at it, it actually aids and helps you with not getting that fatty, oily, carby foods.
Yes, 100%. I was actually reading something where Ramadan can be a time where you can actually engage with your health. You can see health benefits over this time. Most people will actually lose weight, won't you? Because you tend to reduce the amount of calories that you eat. It's just that depending on what you're eating, there's the potential for.
Let's talk about what you eat. So what kind of changes can you make in the morning for suhoor and also for iftar in order to make best use of getting your body the sugar levels that it needs and enough nutrients for the day as well.
So I think for that, what I must do is I must bring in this wonderful cookbook, because it's really given me so much insight into how I should advise my patients about their eating during Ramadan. So the first principle is just that we want to get our macronutrients in the right ratio. So macronutrients are our carbohydrates, our protein, our fats, and we want to keep those balanced. So in a meal, I think we showed the Ramadan plate. We want our carbohydrate portion of the meal to be about 25% of the meal, and then we want a large portion of vegetables, because that is going to give us healthy fiber that we need, and we also want to include proteins and fats. So at the morning meal, at suhoor or sehri, it's important not just to have carbohydrates. We must include those fats and proteins, because that is what's going to sustain you for the course
and
of
what
the
samples,
day.
what examples can you use for those fats and proteins?
For fats and proteins. So an example is if we look to this book where we have lots of things, what can we actually have for cereal? The examples are an apple and cinnamon oat bowl, and in these bowls they've got the oats, but they've included things like pecans, which are an important source of protein and also healthy fat.
That's so
there are a lot of
lovely
breakfast
to add,
bowls that we've got here, and the lovely thing that I like about the book is that it gives you your recipes for the morning, and it tells you how much carbohydrate am I eating, also how much protein and how much fat. So you want something that's going to be balanced.
Absolutely.
The other tip that I have for suhoor is fiber. Very important to include fiber. We want about 25 to 30 grams of fiber in a day.
Yes.
But if we have a high fiber meal in the morning, that is also very sustaining, and it maintains your satiety. So you're not going to feel too hungry during the day. So how I would suggest adding fiber to a diet is often if you add a green to what you're eating in the morning. So personally, I love to add raw spinach to my smoothie in the morning. It's a big source of fiber. Chia seeds are very, very good as well.
They're so easy to eat as well.
And then we spoke about iftar. What changes can we
Before
make there?
we chat about iftar, we need to go and pay the bills quickly, Dr. Naidu. We'll come back with more on what to eat for iftar. We've just gone through a little bit of suhoor. Your questions on Ramadan and fasting just after this with specialist doctor physician in studio with us. Back in a moment. Don't go anywhere. Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Maybe it's daytime wherever you are because you're streaming via our live stream on hilaal.tv. Don't forget to interact with us via our social pages. We have specialist physician in studio, endocrinologist, diabetologist, a word we don't often use, specializing in diabetes, Dr. Naidu in studio, and that's just the tip of the iceberg of what she specializes in. But thank you so much. The love for diagnosing and treating young people is also something that we were chatting about. But just before the break, our meal plans for suhoor, Seri, as iftar. So I stopped you just before iftar.
Yes. So a few tips for iftar is also just to try to control the calories at that meal. As we explained, if we're going too high in calories, we are going to see a spike in the blood sugar after iftar.
So one samosa.
One of my teachers and someone whom I really admire in the profession, Dr. Hussein Randri, was speaking the other day about dates, and he was saying, dates. It's such an important practice to break one's fast with a date, but just be careful how many you're eating.
Very true.
Because they do, they do have a high sugar content.
Yeah.
The other important tip for iftar is to make sure we start hydrating properly at that time, and that we drink, throughout the non-fasting hours to maintain our hydration for the next day. And also we should try to avoid things that are going to cause too much of a diuresis, too much running to the toilet. So these are caffeinated beverages. So just to avoid, if too much tea and too much coffee, because that will actually can lead to dehydration.
So some of our viewers have asked us some questions around glucose levels and when fasting. How often should I be testing my glucose levels when I'm fasting?
So, however, it all depends on what treatment you're on for your diabetes. So if you're living with diabetes and you're just taking tablets only, then you don't need to do such frequent testing. You probably, one of the most important tests you're going to do is testing in the morning around suhoor and testing around iftar as well. You should also test at any time when you have symptoms. Remember, we spoke about it being difficult to actually know when the symptoms are due to low or high blood sugar. So any headaches, dizziness, sweating, palpitations, extreme hunger, please go and check your sugar at that time. For our patients who are on insulin therapy, that's when it starts getting a little bit more complicated. Depending on how many injections they're taking and the type of insulin they're taking, the doctor will then recommend to you how many tests you need to do for the day. It actually can get quite complicated, however. In our patients who are taking multiple injections of insulin, we may ask them actually to test 6 times a day. But fortunately, there is some technology which is coming now to make that a little bit easier.
Okay.
So I'm not sure if you've heard of continuous glucose monitors before.
No.
But this is sort of new technology in diabetes. We use it more so in patients who have type 1 diabetes,
Okay.
but there's also a role for patients in type 2 diabetes. And what this is, it's a device. It's a little wearable device. I've actually got one on me at the moment.
Okay.
And what it does is it links up to my smartphone via an app.
Okay.
So I don't need to go and prick my finger to know a sugar reading.
Wow.
I get, continuous information on my phone about what my sugar is doing.
And you can wear this patch?
You wear this patch, so depending on
all
the type,
day?
I've got one which lasts for 10 days. So you would need to change every
10 days.
change it every 10 days. But this is very useful for people living with type 1 diabetes, where we need a lot of information about what their sugar levels are doing.
And then, of course, they can monitor. There's a history and everything on the app, I'm sure.
So it gives you a history, it gives you a trend. And sometimes a trend it gives you a lot more information than just looking at a single reading, because you can see, am I stable? Am I going down? Am I going up? How do I react to this?
Brilliant.
So it's actually very nice. And also, for our patients who are at higher risk but who still choose to observe the fast, where we know that there may be a risk of low sugars or hypoglycemia, or where we know that there are complications, this may be a very valuable tool for them to actually incorporate, because the whole idea of this is to know what your levels are doing, detect complications early and react to them early.
That is our next question, and it says how and at what level of sugar should I break my fast?
Should you break it
when my health is at risk?
Okay, so we advise for the lower limit is less than 3.9. We should be breaking the fast then. And high sugars, anything more than 16.6 is what we advise as the level to break the fast. And some patients may say, oh, but my sugar is usually around the level of 16. Well, the thing is, when you're fasting, you're at higher risk, because remember, you're not eating, there's medication on board, there's dehydration, which is also at play. So at that level of 16, with all of the other factors taken into consideration, there is then a risk of complications.
So we have different types of diabetes. How does those different types of diabetes affect a fasting person?
A fasting person. So the different types, the two major types are type 2 and type 1. Type 2, 90% of people living with diabetes, usually a positive family history and lifestyle risk factors. Type 1 is the type of diabetes which tends to affect more younger people, and these patients they have no pancreatic insulin secretion at all, and therefore they have to be on insulin injections. So our type 1 patients tend to be at higher risk because they are dependent on insulin, and they may get more serious complications. One of the complications they may develop is something called ketoacidosis, and this happens when the sugar levels rise very high and there's an accompanying increase in acid levels in the body. That our type 1 patients may be at risk of this because they may be omitting insulin doses when they're not eating, and that deficiency of insulin is what can then cause this complication. But really, how both patients with type 1 and type 2 are susceptible to the complications, it is more a function of the state of the diabetes. So if you are older, if you've had diabetes for a longer duration, as in more than 10 years, if you have a history of complications in the past, and if you are using therapy that can cause low sugar, whether that is insulin or whether that is tablets that can cause low sugar, then you are at risk for complications, and you just need to manage yourself a little bit more carefully if you choose to observe the fast.
So is it true that patients with type 1 diabetes is exempted from fasting?
So yes, to a certain extent it is true, but we do know that many of our patients with type 1 diabetes still choose to fast. So if that is the case, if they're still going to do that, what we want is we want them to be well controlled before they start fasting. The risk comes in if you've got poorly controlled diabetes, very high baseline sugar levels, and then we embark on fasting.
Okay, so we've heard about some new technology. One you've mentioned of those that needs to monitor their diabetes all day, and they'll show a rise and a good line of comparison. But in the new technology I've read on a bionic pancreas.
Oh yes.
And this will be used to automatically deliver insulin to the body. How accessible would this technology be in South Africa?
Well, the sad thing about South Africa is we usually get our technology a little bit later on,
Okay.
and this is something which is still in development and research. So many years before it filters down to us.
Okay.
But having said that, we still do have some very interesting technology for our patients who need it. We have various insulin pumps which are available, and the value of an insulin pump is that it takes away the patient needing to inject themselves with insulin. So it will deliver the insulin to the patient. And it also has very interesting mathematical algorithms. So it's able to work out how much insulin the patient needs. So this is something that I would use a lot for my patients who have type 1 diabetes. But as you mentioned, Khawa, we are a resource limited setting. Access is a concern. Affordability is a concern. These insulin pumps and in the region of 40 to 60,000 rand just for the pump. Then you have to purchase additional for all of the tubing and consumables and insulin you need to work it. So it's really, a sadly beautiful technology and life-changing, but not available to 95% of our patients living with diabetes.
We have to wrap up very soon. I know I still wanted to talk about myths and misconceptions, but tell me, what tips do you have when visiting a doctor?
So that's a good one. I think I can say things that it'll make it easier for me to see my patients as well. Please bring your medication, especially if you're visiting doctor for the first time. We want to see, exactly what you're on. And the other thing is bring us some readings. Even if you haven't monitored your sugar for months before the appointment, in that 3 to 5 days before the appointment, be strict about monitoring. Do your morning readings, test 2 hours after meals. Bring us that pattern, because that will give us a great idea of where you stand with your diabetes.
Okay, so that's so important, and often we don't look at that. But quickly to slip in there, and as just to wrap up, there's been some questions around after effects, symptoms of your medication, that it affects the kidneys. Just as a wrap and in conclusion, Doc, just give us some information around the myths and misconceptions and your last words on diabetes and fasting.
Okay, so I think what you were alluding to there, the medication that affects the kidneys and which everyone is concerned about, is metformin. And that is a big myth, because if we start, metformin is a very valuable drug for diabetes. If we start it early on, it's actually reducing your sugar and thereby protecting your kidneys. I think where the concern comes in is that doctors have to reduce the dose when you develop kidney problems, and that is because if you use metformin in the setting of kidney damage, it can build up in the system and cause side effects. But if you've got healthy kidneys, absolutely, perfect, go ahead and use it. It will do you good.
So it looks like we're going to have a follow-up show with you, Dr. Naidu.
I think we
possibly
have to.
On Zoom, because unless you're coming back to Johannesburg.
There's so much still to say, and you've got me so excited. And I can't believe our time has gone by so quickly.
You just can't stop. And I must say, we have a brilliant person in studio with us, so definitely have to do a follow-up, Dr. Naidu. Thank you so much for your time.
Such a pleasure.
Safe travels back to KZN.
Thank
you. All the best till we chat again.
And may I wish all the viewers a blessed Ramadan. May it be fulfilling and safe as well.
Thank you so much. Amen. Thank you so much. Dr. Kumari Naidu chatting to us, endocrinologist, specialist physician, diabetologist. Remember, send your questions, comments and queries through, and hopefully she'll get to answers. Stay with us for next week's show as we speak about arthritis, knee pain, sports injury, any questions around your aches and pains of joints. We have a specialist physician in studio with at least online with us, and you can send your questions through if you have any questions for him around that. So thank you so much for joining us in this week's edition of Your Health and Wellness Show. Assalamu alaikum and goodbye for now.